The National Association of Social Workers Statement on Healthcare.
To quote the policy statement directly, NASW supports the long-term goal of enactment of a national healthcare policy that ensures access to the full continuum of physical and mental health services for all people.
They also support the Affordable Care Act, including Medicaid expansion in every state and access to this care for undocumented immigrants, as well as equal reimbursement from Medicaid.
The National Association of Social Workers also states that they stand for Medicaid reimbursement for licensed clinical social workers in the mental health field, as well as policies that mandate licensed social workers be the ones who provide mandated social work services in the medical field, along with funding to complete research that shows the effectiveness of social works in the healthcare field.
They support funding and expansion of interdisciplinary education and workforces between social workers and other healthcare disciplines. This will help meet the needs of the growing demands for full continuum healthcare that is supported by NASW.
So, how do they plan on making all of this happen? I'm glad you asked.
NASW states that Healthy People 2020 is the vision for improving the health of people in America. Healthy People 2020 is a federal government prevention agenda for an overall healthier nation. It launched in 2010 with 4 main goals. 1. To gain a high-quality, longer life free of preventable physical and mental health illnesses. 2. To gain equal health access and eliminate health disparities in all groups of people. 3. To build social and physical environments that create good health for all. 4. Promote a high quality of life built on healthy development and behaviors throughout all life stages.
NASW supports the Affordable Health Care Act. They state that though it was built on a broken healthcare system, it moved America in the right direction. The ACA was brought to life due to the high percentage of people in America without health insurance.
The ACA has made fundamental changes to the delivery of healthcare in America. It expanded access to parental insurance coverage to the age of 26. It also provides federal subsidies for health plans that are bought out of pocket, not through an employer. It got rid of exclusionary laws by guaranteeing coverage, removing coverage limits, and eliminating higher rates based on gender, age, and health status.
Why do we need this to happen?
Since the ACA was founded on a broken system, there are still remaining challenges.
Partly due to America's large health disparities, NASW's healthcare statement was formed.
NASW's statement says that the full continuum of physical and mental health care is for all people, regardless of race, gender or gender expression, age, religion, ethnicity, sexual orientation, cognitive or physical functionality, immigration status, geographical location, or socioeconomic status.
Racial and ethnic minorities are still falling behind when it comes to healthy outcomes. A national healthcare policy would help mitigate this issue, although it is not the only issue when it comes to minority healthcare.
To really address the health disparities in America, the following will need to be addressed along with insurance issues. 1. Stigmas that are still rampant in the healthcare field. 2. A lack of cultural competencies among healthcare providers. 3. A lack of health literacy. 4. The failure to include minorities in most medical research, and added attention to the way socioeconomic status affects a person's health.
With the large expansion of Medicaid due to the ACA, there is a shortage of service providers. The shortage is higher in the mental health field as Medicaid does not reimburse independently licensed clinical social workers for mental health services.
Licensed social workers are able to practice independently in healthcare settings, but are often supervised by members of other disciplines due to a lack of consistency in the application of the policies.
Hospitals are run this way due to billing and reimbursement issues. This is due to policies that require billing for health, behavioral, and assessment interventions to be performed by or under a clinical psychologist. Clinical social workers are equipped to perform such duties.
There are concerns regarding the lack of policies, which allow states the option to decide whether or not Medicaid will reimburse for clinical social work services.
So, where do social workers come into all of this?
Well, research suggests that social workers prove to be most effective in all areas of healthcare.
There is a great need for social workers in the healthcare field as they are essential in primary care where psychosocial needs are high. Social workers utilize their skills to enhance the lives of others.
Hospitals are starting to see the need for social workers due to lower reimbursement rates. Medicaid only reimburses at 75% of costs. Social workers in the healthcare field have been proven to be most effective in decreasing the number of hospital readmissions. Social workers can use their distinctive skills in resource utilization and team-based care coordination to make this happen.
I hope now you have a better understanding of NASW's statement on healthcare.
You understand why social workers are needed in healthcare.
And what issues we are still facing in the American healthcare system.